Hi, everyone. My name is Melissa McCallum, and I'm the Executive Director of the Greater Hamilton Health Network. Today, I'm going to go through a quick overview of the work that the GHHN does as an Ontario Health team and how it's going to relate to the Social Prescribing Project. I'm just going to share my screen. So, Ontario Health teams were actually developed in 2019. And a part of the reason they were developed was to look at how to more locally plan healthcare for the province of Ontario. And if we look at, just the population characteristics of Ontario alone, it's a very large province with over 14 million in population, with a high percentage of seniors, and we know that that number is growing. We see a growing immigrant population. The last census was at 29.1%. And we also see local and on-reserve urban Indigenous populations across the province. When we look at the relationships between Ontario Health teams, the ministry, and Ontario Health, what does that all mean for local healthcare planning? And the three bodies have distinct planning roles. I'll start overall with the Ministry of Health. This is where we see that overall health system priorities and policies are set. They're also responsible for all the legislation, regulations, delegation of authorities, and standards for the health system as a whole. They are also responsible for approving new healthcare investments. This is where we see the funding coming into the health system. Along with Ministry of Health, we have what's called Ontario Health. If you'll remember a couple of years ago, Ontario Health was really created as a super agency. 23 agencies, including things like HSSO, Trillium Gift of Life, Cancer Care Ontario, were all folded into one massive organization called Ontario Health. At the same time, Ontario Health actually replaced the 14 LHINs. This regional kind of authority oversees the implementation of priorities. They work with health service providers to manage health system priorities, capacity, performance. They address and manage certain regional programs. There's also a level of developing clinical standards and delivering highly specialized services. This is where a lot of the ministry accountable agreements sit, and Ontario Health has a role in how organizations are accountable and how they're performing. And then we have Ontario Health teams, where the GIN sits. And really, a large portion of our role is to locally plan and integrate healthcare, within more of a community context. So all Ontario Health teams have an attributed population, and it's up to us to look at a population health lens and understand how we can integrate programs, bring in services to improve population health as a whole. And we do this by working with member organizations, people that work in health, social care, charity organizations. And our goal is to really improve the system, create value, be sustainable, and be equitable for all. When we look specifically at Ontario Health teams, that's really quite a newer way of organizing healthcare in Ontario. As stated, they were first started in 2019. And the government at the time really wanted to see health system priorities strengthened locally. How are we going to make it better for patients to navigate the system? And really ensure that there's that seamless transition between providers, between sectors. So I describe the Ontario Health team as people, patients, and organizations working without borders, understanding that connecting care requires all of us, and that to have a truly integrated system, we need to work together. And that includes cross-sectoral partners, from hospitals to physicians, home care. Our social partners and municipal partners all have a role to play when we're planning for our Ontario Health team. The previous system felt a bit disconnected. There's disconnected records moving in between sectors, and really navigating through the health system these days can feel extremely daunting. And we see this disconnected service, across a number of sectors. And how can we move from that disconnection to a current system and a future system where we're all connected with a patient at the very center? And this is really the core of what the Ontario Health Team is trying to do. Bring in all of those services that are, providing excellent care to individuals in our community, but really moving to a continuum where we're all doing that together. We're working in synergy, we're unified on a common vision, and we're understanding how to transfer in and out of these very specific areas of care seamlessly and easy for the patient and their caregivers. So who's part of an OHT? And really, the Greater Hamilton Health Network has a very, very broad membership. And I say that because we know and have learned over the last few years, and especially through the pandemic, that so many people have a role to play when it comes to integrated care. It is not just about health service agencies. It's those important social and municipal services, but it's down to places like food banks and charities and churches that are really all part of the continuum. And it's weaving that together that's part of the Ontario Health Team role. Each organization, part of the GIN, are responsible for contributing their unique expertise. We don't come into the work already knowing exactly the end state. We want to work with providers, patients, people with lived experience to help shape what's most meaningful to them. In terms of the Greater Hamilton Health Network, we are one of the first Ontario health teams in the province. We were approved in November of 2019. And now in 2023, there are 57 approved OHTs. That is full provincial coverage. We are a larger Ontario health team with an attributed population of approximately 700,000 residents that span 3 distinct geography regions: Hamilton, Haldimand, and Niagara Northwest. We also appreciate that the GIN supports individuals from 2 reserves, Mississaugas of the Credit and Six Nations of the Grand River. So considerations for on-reserve and urban Indigenous care are important. When we look at our populations, there's a mix of rural and urban communities, and with that brings its own challenges. All areas of our OHT have high areas of material deprivation. We know that there are high-risk wards, and Hamilton has one of the highest concentrations of urban poverty within Canada. And across the province, we also know that our population of seniors is growing. And we all share that mental health and addictions is a significant local health burden. And these concerns have only been exacerbated by the pandemic. When we look at the vision of the Greater Hamilton Health Network, we want a healthier community that provides an equitable and seamless continuum of care that actively improves population health and meets the individual needs of our community. We strive for a population that is healthier, activated, informed, empowered, and treated equitably. And our mission is to build community health together. I wanted to mention our staff team at the OHT. This is the project management office that gets up and thinks about, the GHHN every single day. And you'll see the staff here on the screen and their portfolios. We also depend on all of our partner organizations to lend into this work. So it's really a full team effort. But right now we have 8 full-time and 2 part-time employees as part of the OHT. When it comes to, our strategic plan, our OHT strategic plan really reflects both local and provincial priorities. The GIN prioritizes and makes decisions on care pathways based on 5 core principles, but we also want to remain nimble enough to respond to ongoing system and community pressures. Our 5 key areas of support are integrated population health, ensuring that patients can navigate the system and the use of digital care. We know there's a portion of work that still needs to continue on responding and recovering from COVID-19. We have work going on in terms of governance. And then we're ensuring that primary care engagement and leadership is at the center of our Ontario Health Team. But surrounding these 5 pillars of priorities are 3 extremely important, locally driven priorities for our OHT. And those include equitable healthcare approaches, including patients and community and engagement, and then actually thinking about the environment as we, propel integrated care initiatives within our community. We have several working groups under the OHT. This is just a few of them. I won't go through them all, but you'll see that there's such a breadth and mix of things that the GHHN is thinking about on a daily basis. And these things range from how we develop, a really robust primary care network, to looking at integrated, clinical pathways for lower limb preservation, women who are homeless, and mental health and addictions. There's a lot going on. And again, these are really a mix of what the province wants to see as Ontario Health teams progressing, but what we as communities have also seen as being really pressing for us to focus on. In terms of the organizational structure, the Greater Hamilton Health Network has a formal board. We have some key stakeholder councils that have, strategic relationships to the board, and that includes patient and families, health equity, Hall Demand, and primary care. And then underneath that, we have several of those working groups, as you just saw on the slide before. In terms of some highlights over the last couple of years, the GHHN has actually achieved quite a lot, even through a global pandemic. We were the first Ontario Health team in the province to incorporate. We've won an International Top Integrated Care Award in Denmark in 2022 for our work with women's homelessness. We've prioritized extensively from the beginning a focus on health equity. We've created a centralized hub for online appointment booking for primary care providers in our GIN so that patients can log on and book with their primary care provider easier and faster. We've served over 400 women through our GHHN Women's Health Drop-In Days, where we see health and social care come together to provide low barrier, on-the-spot medical, clinical, and social care for women who are homeless and vulnerably housed. We've supported over 16 digital health initiatives spanning acute and community care. Health equity is very much a starting point for our Ontario Health team. In January of 2021, just after, we were coming out of the pandemic, we started to think about what does the Ontario Health team look like? We wanted to start this work off with a health equity framework and report. We hired a special advisor to lead this work for 6 months as we were developing. And the mandate was really to advise us as to how we could deliver care to patients from a lens of health equity. How do we operate this whole entire project management office? And then what does the governance and corporate culture of the GHHN look like when it comes from a health equity lens? There was 2 primary outputs from this health equity work. Number 1 was an extensive health equity framework report, which helped give us 24 key recommendations about how to move an equitable health agenda forward. It also provided us with a health equity supplementary report. This report focused on population-specific communities. It provided us a summary and specific focused key points to describe the barriers, experiences of key populations that our Ontario Health team was going to serve. Those population-specific communities are here on this slide, and we are always more than happy to distribute our health equity report. It is one part of the beginning of moving health equity, and making it a foundation to our Ontario Health team. We've taken some of these recommendations from the population-specific community reports and the overall report to shape a health equity work plan to move forward. We also adopted a health equity framework that helps guide our work moving forward. This framework was actually first developed by Ontario Health. And after doing our 6-month health equity review, we felt much of this framework actually addressed what we were seeing locally and the priorities that we wanted to advance. We did feel that we needed to add an anti-oppression lens onto this work, so you'll see that at the top. And then with our specific populations, there are populations within the Ontario Health framework that weren't called out specifically that we want to focus on within our community. We adopted a policy statement as it relates to our health equity work. We acknowledge that oppression, including racism and hatred in all its forms, makes people sick. And we are adopting a commitment to health equity that addresses anti-Indigenous and anti-Black racism and other forms of oppression, ensures that we have the provision of French language services, uses a sex and gender-based analysis, and changes practices to address systemic barriers, power imbalances, and an equitable distribution of resources. I'd like to move on to governance because the GHHN is seen as a trailblazer when it comes to governance within the province. As stated before, we are the first Ontario Health team to formally incorporate into a not-for-profit entity. Since we've done that, the Ministry of Health has advised all other 56 Ontario health teams that they now have to follow this governance model moving forward. Why did we decide to do this? It was for several reasons. We had already very mature partnerships within the region that we wanted to capitalize and build forward in a faster way. We knew that incorporation and a board provided a structure that was accountable and something that organizations were familiar with. We want to be able to have autonomy in operations, the potential to receive funds, procure, hire, and overall be a service delivery agent in the community. In terms of what incorporation really means and some of those key messages is that individuals are not going to be members, but that they can be part of councils and working groups as part of the OHT. And something that we're very passionate about is that any organization can be part of the integrated care work that we do. We know that it's extremely important to have the whole continuum at the table. That's the municipality, social organizations, healthcare organizations, public health, small and large community organizations, charitable organizations. Like stated before, everyone has a role to play in the health and well-being of communities. It's important to note at this time, the funding and accountability of organizations still remains in place as per their historical agreements with Ontario Health and the ministry. But we are moving forward with creating what's, a code of conduct or a membership agreement as part of the OHT. These are all things that are a work in progress as we move forward our governance work. So much of the work that we do at the Ontario Health Team is through Collective Impact. And Collective Impact is a network of community members, organizations, and institutions who advance equity by learning together, aligning, and integrating their actions to achieve population and systems level change. We do our work by working under this collective impact model. We need all parts of the system to participate in health. That includes health, social, housing, municipal, and community providers. It's only then that we come together that we can address some of those system gaps. It's only that we can come together that we can also promote a health equity approach that decreases the previous silos that healthcare planning was in. I want to talk a little bit about some very real life examples of collective impact that the GHHN has undergone in the last few years. One of the most meaningful parts of our work has been women's health drop-in days. These are drop-in style clinics specifically designed for women who are homeless. They offer a variety of health and social service supports using this one-stop shopping approach. We go to where women are seeking care. This could be a shelter or a day space or a housing environment. We provide vaccinations, mental health resources, naloxone training, primary care, STI, HIV testing, housing supports, wellness activities, food, clothing, feminine hygiene products, and peer support. To date, we've held these days once a season for 2 afternoons and served over 480 women across Hamilton. It's been an incredible effort to see so many people come together on site and just care about providing equitable, low barrier care from a harm reduction lens. And again, we were so proud of this work as we won the International Integrated Care Award at the International Conference of Integrated Care in Denmark in 2022. Another important project through Collective Impact has been LEGO. And the LEGO is the Let's Go Home program and really aims to reduce hospital admissions by connecting patients accessing in the emergency room of our hospitals with bundled community supports. So patients are met with a LEGO community care coordinator who looks to alleviate some of the burden of planning for, a successful return back to community. We know that community services are less expensive, and they also help to address the root cause sometimes that the patient is facing. The community connector meets the patient in the hospital and goes home with them for the next 4 to 6 weeks. They become the one point of contact for the person and for their family and caregivers. And things that they accomplish are housing supports, meals, caregiver support, appointment organization, and homemaking. And this program is located at all 3 hospitals within the GIN, including Haldimand and Hamilton. We've really progressed a digital health strategy over the last few years and developed an integrated digital health system that really focuses on both patient and provider access and technologies. The GIN is seen as a leader in surgical transitions, remote patient monitoring, with over 2,000 people served between both hospital sites in Hamilton. We've registered over 325 primary care providers to sign up for online appointment booking so that their patients can log on and book appointments right from the comfort of their own home. We've expanded our website to include a find services and patient booking page so that we can support people locally trying to navigate through the health and social system. And to date, we've completed 16 digital health initiatives spanning acute and community care over the last few years. That's just a quick snippet of what the OHT, the Greater Hamilton Health Network for Hamilton, Haldsman, and Niagara Northwest, is up to. We're so looking forward to the social prescribing project. It aligns with so many of the mission and values of our own organizations and really progressing, an equitable health agenda for Hamilton. These are our social media contacts. Looking forward to working with all of you. Thanks very much.